Good morning, everybody, and welcome to our discussion, Designing the Technology Toolkit for Senior Living. Thank you all so much for joining. I am Terence Ronson, founder and managing director of Pertlink. We are IT consultants focusing on hospitality and senior living, and I will be your moderator today. Let me first set the scene as to why we are having this discussion. According to predictions that were made by the United Nations back in 2015, it was forecasted that by the year 2100, the global population could surpass 11 billion. Currently, China, India, and USA have the three largest populations in the world, but by 2100, this will have changed to Nigeria and China, respectively. A shifting age structure is also a key aspect of this transition. By 2100, over a quarter of the world, or nearly 2.37 billion people, will be aged 65 years and above. Taking a more localized view, according to Aging Asia and their recently published age report, there will be 600 million seniors or people over 60 in the Asia-Pacific region by 2025, which is just 5 short years away from now. And this amounts to some 25% of the world's population by 2050. This clearly indicates there will be a demand for elder care, whether at home or in a purpose-built senior living facility. Technology can definitely help improve the quality of their lives and ease the burden of those angels, as I like to refer to them, who look after the elderly. Companion robots, wearables, and telehealth are among various tools that can help make life as a senior something to look forward to. Today, our esteemed speakers will provide insights into evolving industry practices and how technology is becoming more and more relevant in today's and more so tomorrow's aging society. And let me add, nothing we discuss today will be too old for seniors. And so welcome, gentlemen. Now, just before we start our conversation, I'd like to remind you of a couple of housekeeping items. Firstly, this session is being recorded, and a link will be made shortly after we finish the webinar and sent out. And as part of Zoom etiquette, we please ask that you keep your mic muted so as to avoid any background noise. Secondly, we really want to make this session as interactive as possible, so we will open the Q&A facility. If we don't get round to answering all your questions, we will do our best to get back to you afterwards, so please bear with us. So now let's kick off by each of the panelists quickly introducing themselves, and then we'll get into the main discussion, which promises to include some really exciting demos. So first of all, over to you, Jerry. Let me just mute Jerry.
Trying to start my video. Can you hear me?
I can hear you, Jerry. Yes.
It's not letting me start the video for some reason.
Okay, just let me see if I can help you there. Please try again. There you go.
Excellent. Get my lighting just right. Well, greetings from Fort Lauderdale, Florida. My name is Jerry Wilmink. And can you hear me okay, Terence?
Yes, can hear you fine.
Okay, fantastic. And I'm the Chief Business Officer at CarePredict. And I've been in this role for almost 3 years now. I previously was the founder and CEO of a wearable technology company for seniors as well. So I've been in the senior health technology space for almost 10 years now. Prior to that, I actually was the program manager for the SBIR program for the Department of Defense, which is a $3 billion program, sometimes referred to as kind of the government's VC fund, to fund like new and innovative sensing technologies. And that's where I got the bug for really developing innovative solutions for real problems, especially in healthcare and biomedical engineering. And before that, I spent a lot of time at Vanderbilt University and did a PhD in optical sensing in biomedical engineering, and did an MBA at University of Texas. But really excited and honored to be invited to speak tonight. So thank you, Terence, and thank you all participants.
Thanks, Jerry. Really appreciate you joining us, especially knowing the time difference between Asia and Florida. Okay, we're now going to hand over to CP. So CP, over to you.
Hi, good morning, everyone. Sawadee krap. I'm live from Bangkok. My name is Chalermpon PUNNOTOK. You just call me CP for short. And we have been built the robot for 10 years, and we focusing on the elderly care. We have successfully exported to Japan like 4 or 5 years ago. And now many hospitals and nursing home in Bangkok using robot. The Thai name is Dinsaw, it means pencil. So you can call pencil or Dinsaw, whatever you want. Behind is a dashboard that we will show you, demo you after this. Thank you for your time.
Thank you, CP. Appreciate it as well. Michael, we're going to now move over to you.
Yes, thank you, Terence, and a pleasant day to everyone. I'm Professor Dr. Michael Joseph Dino, the current director of the Research Development and Innovation Center of Our Lady of Fatima University, which is a private autonomous higher education institution in the Philippines. So I'm working in the education and research industry for the last 15 years, and I'm also serving as the president-elect of the Phi Gamma chapter, the only virtual chapter of Sigma Theta Tau International Honor Society in Nursing, the second largest professional nursing organization, with Dr. Rita Muli Gallagher as our president. As a researcher, I am particularly interested with applications in the fourth industrial revolutions. Again, a pleasant day.
Thank you very much, Michael. And it's a pleasure to have you also with us. So what we're going to do today is we're going to try to make this really as interactive as possible. And I have some questions that I'm going to throw open to each of you. And I know that Jerry and CP, you're going to give us a little demo later. So we'll hold on that for now. And we'll try to open up to questions as we go through. So I have a chat window open on my screen. But Jerry, let me first of all kick off with you. You recently co-authored a paper about real-time digital contact tracing and the development of a system to control or to help control COVID-19 outbreaks in nursing homes and long-term care facilities. As an aside to this, market research company IDC, or the International Data Corporation, says that tech for in-office contact tracing, that is tech which tracks which employees interact and where they interacted and for how long, could soon be worth $4 billion annually in the USA. And I guess that's also something to think about as you get into this contact tracing business. But Jerry, for today's call, can you please summarize what your findings were from that report? How CarePredict can help and how the community as a whole should address these points going forwards?
Yes, well, thank you, Terence. Obviously, it's a very hot button right now. What our company found very early on in probably the February, March timeframe is that many of our customers in independent living, senior assisted living, and memory care were struggling, where they were having issues where many of the senior residents were suffering COVID-19 illnesses. And we knew that given the vulnerability of seniors in particular in nursing homes and in independent living, assisted living, memory care communities, we needed to make a solution. So fortunately for us at CarePredict, we had many customers that were wearing our wearable device. So seniors, senior residents, the staff members, and even visitors. And we had an infrastructure built that allowed us the hardware and the real-time location systems that were already in place. So what we quickly did in a 3-week sprint was develop a software platform called Pinpoint, which allowed us to identify if there was an infected person in that community, to basically rewind in time and see all the individuals that they came in direct contact with and in what rooms for, say, a 2-week period. So basically, it allowed us to do digital contact tracing in seconds. So you would know exactly which individuals the senior resident had come in contact with. So what we did to kind of build off that was we developed one of the first simulation tools, and is actually a computational model that allows us to simulate what happens in a senior living community if you, say, had 10 pre-symptomatic SARS-CoV-2 infected residents. So they're either pre-symptomatic or asymptomatic. They're not exhibiting the signs, the signature signs, so fever, cough, or even shortness of breath. And so they'd seem like they're relatively normal, and they're not exhibiting those signs. And so they may not even been isolated. And we did comparisons comparing what would happen if you use conventional techniques, say using symptom-based monitoring, PCR testing, say on a weekly basis, manual contact tracing, and then digital contact tracing with our system. What we found was pretty interesting, is actually with our tools, due to the speed at which we could identify the individuals that needed to be isolated, we could isolate a particular cohort around an individual that was infected. And then the other individuals in that particular community, we found, could actually continue living their life and not suffer those kind of secondary effects, which we're seeing now. We're seeing many seniors are suffering really a downward spiral because they're being isolated and locked down even when they could have the opportunity to live their life again. So what we found is we could actually reduce the number of cases in the event of an outbreak by somewhere between 52 and 83%. So really reduce the number of SARS-CoV-2 cases using our tool, which then in a 120-bed community can equate to up to 10 fatalities that could be precluded and actually mitigated due to COVID-19 illness. And then also reduce the number of individuals, the seniors, that would have to be on lockdown. And this allows them to safely go out and not interface with the individuals that may be symptomatic or asymptomatic, and actually allow them to get back to their normal life again. And then we can see a reduction of 66% there. So this was published actually a few weeks ago in JMIR, Public Health and Surveillance, and it's in a special issue. I'm happy to provide the link here in the chat as well. But due to this, we've been doing installs around the clock across the United States in particular for this system and our dashboards that have the tool and the interface.
Okay, that's great, Jerry. A couple of things on that. One is maybe what you can do is you can give us the link to that paper. And as we drop a note to everybody for joining, or for some of those that didn't make it, we can include that link so they can download the application, download the paper. And I know in a few minutes you're going to give us a quick sort of demo as to how that works. So we will come back to you. Thank you. Thank you.
Excellent.
Okay. Now, CP, your business is providing robots, which is quite obvious because you have a little robot sitting behind you. But it's not only to senior living community, but also to other businesses. I know that you've been supplying. Perhaps you can tell us how the senior living community is using this technology and what benefits they are seeing, both for the seniors themselves and operationally.
Okay, thank you, Terence. So a little bit of a background. We have been build a robot for nursing home, and we understand more and more what they need operationally. That's why we have to develop not only the robot, but also the whole system, the whole ecosystem that we allow the caregiver or the manager of the nursing home to see every elderly in the building. That's one. Another one, for technician to see whether everything going well, Wi-Fi things, IoT, and the robot itself. So these two dashboard is this room is like for like a command room of each nursing home, and also some hospital. Let me introduce a little bit about the pencil robot or Dinsaw in Thai. The robot have a sensor in the forehead. That all the sensor have all the AI be able to receive the, for example, the voice command, and the robot keep moving and watching me now, as you can notice. So if I lean back or move, the robot keep watching. This is the AI that we developed to detect the human. Even turn off the light, the robot can be able to see myself because the robot see my body temperature instead of the picture or from the camera. Normal camera is a thermal sensor, and that allows the robot be able to watch me. Even I'm do something suspicious like falling down or disappear from the room, especially for dementia or Alzheimer elderly. So the robot in each, we put the robot in each room nearby the bed, and the robot of course act on the caregiver behalf. If something happen, he will notify the caregiver. And also on a mobile application for each caregiver have downloaded. It can be multiple caregiver or relatives or even the nurse or doctor can be notified from the robot that take care of that person. Also, as you can notice here, the color of the dashboard is represents severity or urgent situation. Like right now, there are no red one. That means it's not something emergency or urgent. Except for the orange one is a little bit moderate. It can be the person already wake up or it's time to take a medicine, but he didn't click acknowledge that he already take the pill. The green one is fine. I mean, nothing to worry about the green one. And above there is a number of the robot that on the duty, a number of the caregiver as on duty. So it's operationally it's very important to have enough workforce to take care of the elderly. That's why we have to show that on the top bar above there. In fact, we have BB as a headquarter here of a robot company. We can get commission of the customer who help monitor in that operation. Like above that is place of the location that use my robot, both in Japan and in Thailand, that we are allowed to help the caregiver monitor the operation there as well. The robot itself be able to two big parts. One is to reduce the risk, and one is to make the elderly happy, because elderly always feel lonely and depressed, and no caregiver or relatives have enough time for her or for him. So the robot can be companion as well on the second value. The first value, the reduce the risk, as I mentioned, the robot will keep watching. If I have something suspicious, it will notify. So the elderly that been notified through the mobile phone will connect and see the situation real time. I will show you. Okay, I allow my caregiver to connect. The robot will connect now, and in fact, I don't need to pick up the phone or pick up the call. It's automatically pick up, but to save time, I will click answer. So when I click answer, the caregiver will appear on the screen.
Good morning. How are you today?
So this is the caregiver that can stand nearby or even stand in different location. So in this feature, we can monitor the elderly at any time. She also can be able to control the camera. This is what she control to see, you know, in the surrounding of the room and anything drop on the floor or not, or something like that. That application be able to control the robot from remotely. For reduce the risk is another thing that I would like to highlight is the usually the nursing home or elderly care place we have like a vital sign like a blood pressure device or temperature check. So that device will connect to the robot, and the robot will remind the caregiver or remind the elderly himself to monitor their blood pressure. So all the information will wirelessly through the Wi-Fi to the robot, and if the number is show something quite dangerous, it will alert the dashboard and notify to the mobile app as well, like for hypertension situation like that. So that's on the risk side. For the debate, Alzheimer people, some person, my customer, forget how to pick up the phone. They cannot pick up the normal phone anymore. So in that case, robot is very useful because this guy pick up the phone for her. So the son or daughter or relatives can be not to worry about what happened. Why don't pick up the phone? So that happened as well. So my customer is both Alzheimer people, dementia people, bedridden person also benefit most from the robot. So the second part of the happiness, to help avoid the depression of the emotion of the elderly. So we have something, her favorite song, for example, like the favorite singer, the robot will remember what is the favorite song, and during the day, the robot will offer the music to the elderly, based on, in Japan, is old Japanese song, but I put a English version of the robot, so that's why this guy is Frank Sinatra or the old song. So during the day, the robot offer the entertaining content. Sometimes is the religious content in Thailand, especially is the Buddhist content. The elderly love to listen to the monk. So that's why during the day, while she have to stay alone, the robot play with her. We can set the robot how often to offer things to the elderly. That help. Also make a phone call. Actually, we can give the voice command to the robot. Dinsaw. Okay. Dinsaw. Call caregiver.
Calling a nurse. Please wait.
So this is in case that I need help. So I ask him to call caregiver. So maybe I sit on the bed and not be able to reach the hand to touch the robot. So I give the voice command. The robot call caregiver for me, and the caregiver will come in a minute to my room. Okay, this is a highlight of what he can do. It's more on the medical side, that be our companion to the elderly. Just some highlight for now for this round.
Thank you, CP. I know from our previous discussions and various meetings that Dinso can do many, many more things, especially some fun and exciting things like tell stories, tell jokes. And one thing that I've always made a joke about is, those people who are suffering from dementia or Alzheimer's, they keep repeating themselves, but they can speak to the robot, and the robot will never say, "Hey, auntie, you told me that story already." So it could be quite a fun thing to have that kind of companion robot. And I think we can, if we have time, we'll do a little bit more demo later on. But I want to move now on to Michael. And Michael, thank you for waiting patiently for your time. But before I ask you to speak, I just want to talk a little bit about internet usage in the Philippines. Because this is a big thing. You're based in the Philippines, I'm based in the Philippines, and I know a lot of our audience today is actually come from the Philippines. And in a recent poll that was conducted between December 13 and December 2019, by something called Social Weather Stations, and was published recently in the Philippine Star. It was found that less than half of Filipinos who are 18 years old and above were internet users as of 2019. And they say this is similar to the same poll held in December 2018. So it really hasn't changed much between 2018 and 2019. The poll also shows that 83% of Filipino households have at least one cellular phone, 79% own a TV, 31% a radio, and just 14% a personal computer. They haven't mentioned tablets, so I guess it falls between somewhere between cellular phone and personal computer. They go on to say by age, the proportion of internet users was highest amongst the 18 to 24-year-olds at 86%, which is not a surprise, I guess, followed by the 25 to 34-year-olds at 73%, the 35 to 44-year-olds at 54%, and the 45 to 54-year-olds at 32%, and those over 55, we'll call them seniors, at just 12%. Now, according to SWS, an overwhelming majority of adult Filipino internet users are on Facebook. Again, not a surprise for us to know that. In fact, as of December 2019, among adult Filipinos who use the internet, almost 98% have a Facebook account, 98%. Or to put this into real numbers, it's an estimated 29.4 million individuals. So if you're not on Facebook, you're one of the minority, let me say here in the, you're one of the 2%. This is equivalent to 44% of total adult population of 66.2 million, based on the Philippine Statistics Authority median population projections for 2019. Now, since these statistics were made last year, I really wonder how the landscape has changed because of COVID. And so, Michael, very timely, just before the outbreak of COVID, you had published a paper which examines the role of the Filipino and their attitude towards computer and the internet, and their behavioral intention specifically for telehealth participation. Can you summarize those findings and let us know how you think the Philippine community should address these issues going forwards, especially during these COVID times?
Okay, so thank you very much, Terence, for a very comprehensive summary. And I also agree with your statement about internet usage and device utilization, particularly for mobile phones or smartphones. In fact, based on the recent data, so our mobile phone penetration in the Philippines is about 108%. So it means that we have more mobile phones as compared to the number of the population. So that's based on the recent data. And these are also the same inspirations that I have when I conceptualized my telehealth studies several years ago. My engagement at telehealth studies started in 2013. And from that, I initiated producing research related to the use of technologies in health, specifically for the senior group, which is expected to rise further in the near future, especially for developing countries such as the Philippines. So more than 80% of our elderly are actually aging, or what we call the graying of the population. So, however, even though we are developing countries, so the internet penetration and device penetrations is really reassuring. And the results of my studies are also reassuring for the fact that there are already proven and tested models of technology adoption among Filipinos. So both on the healthcare provider and the client or our patient. So when we talk about elderly, so one of the perceptions is that they are not that used to using technologies, they are not inclined in using technologies, but we are changing that particular paradigm as of the moment. So we have high potentials regarding technology use, and for a researcher's point of view, I believe that there's no turning back. We need to maximize the use of technology in healthcare field, and we can efficiently manage the care of our patients, just like what our other speakers have mentioned and showed earlier, through the use of technological tools because of its proven and evidence-based benefits. I'm also excited on what our friends will share about these amazing things about technologies for the seniors and for healthcare in general. So these technologies, we need to remember, are not aimed to replace the human side of caring, but rather to serve as a complement for us to make our tasks more efficient and our decisions data-driven. So I always mention to my students and my peers that health informatics is currently in, and based from the numerous studies that I published, we need to provide some guide for practitioners, policymakers, and future researchers. We should start working on guidelines and standards because in the Philippines, we don't have that very concrete standards. We should look at the potential challenges and issues, and we should start mobilizing partnerships for a better healthcare for Filipinos. When I say partnership, I'm talking about the partnership between public and the private sector, because I think there should be a match between the objectives of both private and public sector. And for Filipinos, I think we need to leverage, and we should also start working on Filipinizing these technologies to fit our current culture. So that's what I'm doing right now. So I'm producing studies. I'm conducting a lot of studies on how we can understand technology use among our healthcare providers, among our patients, specifically the elderly, and how can we make these models for us to teach the future generation of our healthcare providers, as well as to inform the public about the benefits that they can get from utilizing these technologies, may it be in the healthcare field or in the other aspects of their lives.
That's great, Michael. Thank you for that. And I want to stay with you just for a few moments longer. And then I'm going to cycle back to Jerry. So Jerry, you can get ready. But Michael, just staying with you, you are as you've mentioned here for a couple of times, you're in the education field, which is really a great profession, and you have been really helpful in getting an audience together today for us, and I really want to thank you for that. And I want to give a big shout out for all the students who have joined us. And one of the reasons for holding this session is from an educational point of view, to really not only educate just the general public, but specifically students who are going to be that next generation of people going into the industry and providing care and help to the elders, as well as many others. But you and you and I have again spoken recently, you as a university, you're doing lots of initiatives. You've got lots of great things going on. And perhaps from a practical point of view, you can explain a little bit more about some of those things. And I think if you have time, if you have the facility, you've got a great little video maybe you can show us about your facility if you want, or we can post it out later on for everybody to watch about what's happening within your complex. So perhaps you could just tell us just a little bit more about some of the facilities and services that you're offering at your great facility.
Okay, so thank you very much, Terence. So I'm currently connected with Our Lady of Fatima University, and this is our university is one of the autonomous universities in the Philippines. So meaning we are kind of more independent in terms of providing our programs. Our education and research are of good quality. And I'm very pleased to mention that in our university, we're open with innovations. Our administration is open with innovation. Just in fact, we have this building called the Research Innovation Science and Enterprise. And part of our research agenda is to promote the use of 4IR technology. So when we say 4IR, we're talking about the fourth industrial revolutions. So it's a mixture of different concepts such as the artificial intelligence, robots, augmented reality, virtual reality. And we are, of course, partnering with a lot of organizations, not only in the Philippines, but of course in the world on how we can push through with it. So we have partners located in Japan for the robotics or humanoid robots research. I'm looking forward partnering with one of our speakers, of course, and of course for the use of the tracing application. I'm very happy to partner with that also in the future. In terms of Philippine education, in terms of technologies, I'm really happy for the progress that we are having, because right now a lot of professional organizations, specifically our technical panels of the different healthcare professions, are integrating the use of informatics in their curriculum. Just like, for example, in our College of Medicine, we're not only utilizing research for technologies for our research, but we're also utilizing technologies in education to immerse our students on how they can manipulate these devices, how can these technologies make their learning better. We have an iPad, of course, enhanced laboratory in the College of Medicine. We have a virtual laboratory in the College of Nursing. And we also have a lot of simulation spaces in our RISE Tower. So looking forward, we would like to serve as one of the allies of course, the Philippine government, and of course the private sector as well, in promoting the use of these technologies and discovering on how we can maximize the use of technologies in our everyday lives to make our lives better, to promote higher quality of life, not only to our seniors, but of course for the general population.
Michael, do you have the video at hand that you can show everybody? You can screen share if you like. I've opened up the function.
Unfortunately, I don't have the video right now because my computer is focused here. Or maybe later I can share it at the chat box for our of course audience to see the video.
I think that I have it here. Let me just see
Sure.
if I can find it.
Sure.
While I do that, but maybe what I'll do is in the meantime, rather than keep people waiting, and while I find it, let me cycle back to Jerry. And Jerry, I'm going to come back to you because we were Michael was talking just now about data, and data is really a key thing, not only within senior living but also in general everyday operations today. And you are very big in gathering data, and especially when it comes from your wearable device. So I wonder if you can show us for a few moments how you are capturing data from your contact tracing, which also not only from that point of view, but also how you can give a more sort of 360-degree view, or in some cases, a single source of truth, is a very famous phrase I keep hearing a lot lately, about how we can provide, how we understand what is going on with seniors, how we can be proactive in providing services and be there when it's needed. So over to you, Jerry.
Thank you, Terence. Is my screen being shared?
Yes,
clearly?
it is. Yes, we can see your screen. Thank you.
What I'll do is I'll zoom in here. And I'll set the stage by briefly saying, imagine you're at a residential care community, so an independent living or assisted living community with 120 residents. And one individual becomes infected with SARS-CoV-2. And this may be a staff member or maybe a resident. By the time you realize that you may in fact, get testing back and the results back for PCR, you may have 10 individuals that are infected in that community. And this is what we saw in Washington in the February-March timeframe. So before our solution was delivered to our customers, what they did was use conventional techniques. They said, okay, we got positive test results back for this individual. We go to that senior and ask them, who did you come in contact with the past 2 weeks? And many times, over 50% of the people that they came in contact with, the senior would forget. They wouldn't remember due to, faulty memory, or they wouldn't remember this particular staff member so contact tracing in a manual way was highly ineffective. So as a result, what they ended up doing was trying to isolate and just lock down the whole community. So we knew with our solution, we could give them within seconds a full workup of which individuals came in contact with an infected person, and then isolate that particular cohort. So what I'll show you here is in real time. Let's say that this particular resident in room 411, and we have de-identified this person. So their name is $BNCSPTF. And we're going to go back in time here and see, since they became positively infected today, we're going to go back 2 weeks. So we capture all of during the incubation period, the latent period, and then all of those moments afterward up until they showed symptoms where they would be incredibly infectious. So we can get into that 2 or 3 day window. And so then if I run this, what I will be able to show you now, within seconds here, as this pulls up, is a few different things. First, it gives you a layout of all of the staff and residents that came in direct contact with that infected individual over that 2 week span. Gives you a list of those contacts, the duration in minutes of that close contact in that particular room, and then it gives you a layout, basically an egocentric layout of all of those direct contacts, the secondary contacts, and then environmental contacts. So say, for instance, this particular person may have been in the library for 2 hours, may have in fact contaminated surfaces in that library. And then that person left the library and another individual came in there and maybe played on the same chessboard. And so they may not have come in direct contact, but due to foam-like transmission, it's possible that the environment served as a contamination source. So we have that layout here. And then we also have it broken down based on location. So you can actually go in and decontaminate those particular rooms which have been considered hotspots in this community. So that's kind of a quick overview on our digital contact tracing solution. And then I'll give you one little snapshot too of kind of what our solution does in a more broader sense. At CarePredict, we are known as predicting health declines. So we predict health declines in seniors based on our measurement, our autonomous measurement of changes in activities and behaviors of that individual. So our wearable device, this is fundamentally very different than Fitbits and Apples and other traditional wearables, is that what it's doing is it's measuring the subtle changes in kinematics of my wrist. So when I bring food from table to mouth, it picks up all of those changes in my wrist motion and knows when I'm eating, drinking, washing my face, and creates baselines for me. So then as I see, as the machine picks up those deviations for this individual, it knows, normally Jerry's eating this many hours a day and exercising this many hours and sleeping this many. As it sees deviations, 1 or 2 standard deviation, from those baselines, it knows that I may be depressed, or this individual may be suffering early signs of a urinary tract infection based on visits to the restroom, or be at elevated risk for falls. So we pick up all that information and serve up these insights and cues to the staff so then they can quickly do more detailed assessments. And actually, we've demonstrated we could actually reduce hospitalizations with our tool over a 24-month period by up to 40%. And we've also published that as well, and I'll actually provide that link here. And then the wearable also provides two-way voice communication. So the staff and the senior residents can communicate back and forth. So it's like a little walkie-talkie on their wrist. And then also the device has active RFID and Bluetooth technology to allow for electronic door access. So it's basically their all-in-one device to communicate, open, and provide safe access into different rooms. And then also in the background, collect information on their activities and behaviors to provide the earliest evidence that someone may be suffering a health decline before they've actually shown changes in vital signs or physiological measurements.
Okay, that's great. So you can be both proactive and reactive in that sense, which is really good. Thank you for that, Jerry. I appreciate it. In the space that Jerry was speaking, Michael, I was able to find the video. I grabbed it from the YouTube link that you sent me earlier by LinkedIn. So I'm going to run the video just for a couple of moments and then come back to more questions and answers. Just bear with me.
Sure.
Michael, it looks like a wonderful facility, and I hope that in the not too distant future, I have an opportunity to come and visit and meet up with you and see what see what we can do. Oops, what's going there?
Yeah, sure. And hopefully in the future we can work together on some studies. And because we're looking forward on having research collaborations with you guys for eye tracking, usability, nursing home simulation with the use of these devices. So that's open the doors for all the possibilities.
Excellent. Good news. That's exactly what we like to hear. We've had a couple of questions come in on the chat function, and let me just, there was one from a gentleman called Alan Taylor. Hi, Alan. Alan's based in Singapore. I know him well. And he was asking if there's a good industry website that details technology-based products, service for aged care, and also any user information worth looking at. Jerry's published some link there. I've got a couple of sites. So what we'll do is afterwards in the email that we send out, we can include some of those links and give you access to that information. So please bear with us on that. There was also a question about contact tracing and wearables that was given to Michael. And I think what I'll do is I'll forward that to him to answer that separately after the webinar has taken place. But one of the things that I want to get onto in the last few minutes that we have remaining, time always goes so quickly in these things, is you know, some of the stuff that we've seen today, and Jerry's been showing us the wearable, and CP's been showing us his robot. And Jerry, maybe you could just hold your wrist up again, because a couple of people have been asking if they can actually see what their wearable looks like. And I guess we can send them information about it later in the pack that we send out. I know you've got some great stuff. But do you, these are things that you've made yourselves, okay? This is specific items that you've developed. You haven't really taken something else. You've started from scratch. You've both been either founders or co-founders or part in a startup kind of thing. And there's a lot of other people, a lot of tech companies out there, you know, that I'm sure we can name 5 of those top companies. Do you think that do you think that the tech industry is really paying enough attention to seniors? You know, people say to me, I don't know how to use my phone. I find it really complicated. I don't know how to use Zoom. I'm confused about all this kind of stuff. And this has been really brought more to the forefront because of COVID. And another question is, well, you know, these companies keep releasing these new wonderful phones, but, you know, as a senior, I can't afford this $1,500 or $2,000 to keep changing this. So do you think that the tech industry is paying enough to the senior sector, which we have spoken about earlier, is huge and is really large and is doing enough on that? I'm going to throw that question open to anybody who wants to comment on that.
I'll take that. Actually, you know, with our initial wearable, this is version 3 now. With our initial wearable, you know, we had some of the functions and features that you'd see in an Apple Watch, you know, a digital screen, wireless charging, things that work really well for maybe a young adult that is in the habit of, you know, manipulating a screen on their wrist the size of a postage stamp and taking their, you know, their wearable off at night and charging it every evening on their wireless charger. But what we found is those types of products that really weren't designed for seniors don't work well for seniors. And so we've done things like, for instance, make it all voice mediated and voice activated. Don't have digital screens. We get enhanced battery life due to that. We make swappable batteries, you know, so instead of wirelessly charging, you just swap in a new battery every 100 hours. So now you get this, and you always have the ability for them, the senior, if they fall in the middle of the night en route to the bathroom, which is what we see typically, they now have a device on them. They can call for help. If they were using, say, another wearable that you would charge on in the evenings, they wouldn't have that product available to them to call for help. You know, so these kinds of changes and things to the product we've made to make it specifically for use for seniors, for, you know, both for utility and for their own safety.
And Jerry, just going on from there for one moment, and I think CP's got a couple of comments maybe to add on to this. do you see, you mentioned that your wearable, and I think you call it Tempo 3, if I picked up correctly. Do you see that just being used in senior living institutions, or people can put it into their own home?
Great question. You know, we initially launched, you know, we've thousands of users in the United States, senior residents in IL, independent living, assisted living, memory care. And as we started publishing these results, we had a lot of inbound traffic from the leading home care providers and even family members that wanted this product, the wearable and the beacons, because we actually have beacons that allow us to know the context and location. You know, when I'm in the dining room or whether I'm in the bathroom, that's how we actually can make, you know, really accurate gesture recognition. So we had all this inbound, so we started actually deploying product in seniors in their own homes. So the product is now available. So we have one thread that kind of goes through from the senior in their own home to the senior in their own home that may have home care to a actual senior living environment. So yeah, we currently do sell the product for that environment as well in the home.
Okay. And CP, would that be the case with your robot as well? It can be in individual homes as well as within senior living institutions?
Yes, yes, and plus the hospital.
Okay.
As well.
I guess that's, please.
I would like to share something that I can think of now. We have experience building this companion, but we found that some elderly denying to use this thing because they don't feel attached to the robot. So we have faced that problem. So we find some new technique to help the elderly accept the robot. Many times that we plan to build something, innovation. We'll ignore some emotion side, especially emotion of the elderly. So what we solve that problem is we look at it as we bring the family of the elderly into this piece. So for example, if we combine, it will be great to combine with jury. We can replace like depression period. So the robot can offer some games, and the games put the family member in that game, family member picture in the game, and ask the elderly, okay, what's the name of this person? You know, it can be friends, you know, in the high school, in the old day, or even the superstar in her time. So this bring emotion side in this device rather than just function of the robot. This, for example, another example that is quite worked well is reminding. In a minute, I said that time that the robot will remind me to take the pill, or to remind the elderly to take their pill. But we learned that we should use her nephew instead to remind her grandma to take the pill. So in a minute, maybe in the 2-3 minutes, the robot will show the granddaughter to remind the grandma to take the pill very nicely. So this is happen very often during the day, that we bring the family mood in this piece, not as a robot, but is as a representative of the family members. So that's what we learn.
And it's important to try to bring together the care circle of people who, especially those ones who are sheltering in place or aging in place because they're isolated, especially during COVID times, to have a familiar face or a reminder for someone that they will listen to. And sometimes the older you get, the less people you listen to. So it's more important to be able to select those. Jerry, a question came in. Does the CarePredict watch use Bluetooth to detect others in close proximity?
It's a great question. So what we found is that with most of these SARS-CoV-2 infections, that it's actually most of the transmissions occur in closed, poorly ventilated rooms. And so what we're doing is using our beacons we know when two individuals are in a closed, poorly ventilated room in the exact duration. And so whether that's from a direct contact, large respiratory droplet, whether from speaking or communicating, or it's a droplet nuclei floating in the air, we can pick that up based on the duration in the room. We also have some algorithms that allow us to measure the distance between the individuals. Obviously, they've always, since the beginning of this pandemic, they said, 6 feet. And truthfully, I'm not really sure how accurate that is, truthfully. I think more of the issue is what we're seeing is with aerosolization and aerosol of the virus. And so I may be in a room and communicate in a room, and then the virus is floating in the air, and then another person comes in that room shortly thereafter. And a traditional technology would say that they were not in direct contact. So, but in fact, they may actually be at very high risk for transmission. That's why we've seen most outbreaks are in closed settings. So we have both elements, room, duration in that room from an infected person, and then also the other individual and how long they were in direct contact or in that room setting. So using both the beacons and then Bluetooth from the actual wearable device.
Okay, great. And I know that we can do some interfacing between the wearable and CP's robot, and we can go back to getting all that collating and analyzing of data, which Michael has been talking about wanting to do, so we can produce some really good statistics. And maybe we can talk about that offline, about how we data analyze into much greater depths during another session, because really we're kind of running out of time now. There's just so much to talk about. This is really a big subject. This is our first time to talk about this today. And I think that what we should do is we should get our heads together and think, let's maybe have another session sometime in the future where we can take a deeper dive into one or two of the particular areas. So I really want to thank everybody for the wonderful exchange of information and ideas as we started to learn to design the technology toolkit for seniors, especially during these unprecedented COVID times.
Thank you for the invitation, Terence.
My pleasure. I really want to thank my three panelists, CP, Michael, and Jerry, for sparing your valuable time and this insightful sharing session. I hope for those people that have joined us, it's been a great return on investment of your time. We've had a global audience, and I'm really pleased about that. I see at one time we touched 170 participants. When I first started putting this together, we were in the very low numbers, and I was kind of concerned how many people we would draw and attract to this, but we peaked at 170 today. So I feel really blessed by that. And again, I want to thank Michael for helping to sort of bring people into this, and that's great. So there's really nothing else left for me to say, except that there is a recording being made of this. We will send it out to you shortly afterwards. I think both CP and Jerry would like to include a few things in the packet, so I'll get some links and data from them. So it might be a couple of days before we send it out, but you will receive that from us. And so really all that remains for me to say is to wish you all a great day. Please stay safe and please stay healthy. And bye for now. Thank you.
Thank you so much. Thank you, everyone.